discuss several things and then open it up to everybody's questions about anything in medicine. So let's get going. This is all evidence-based. What does that mean? It means evidence-based medicine is the best medical and scientific evidence from published studies combined with the doctor's clinical experience. This is what I do. I'm, among other things, I'm the editor-in-chief of various journals, etc. I've also published over 100 studies in medical journals. I speak at many different medical conferences, 9 so far this year, from January 1 to May, and I have many more coming up. Just wanted to show you, this is overall publication statistics. I have from the 100 plus journals that I've had, 80,000 researchers and doctors and professors have read it. There's over 1,000 studies have cited my published studies, and my research interest score, which is over here, is higher than 90% of ResearchGate members. The members are all researchers, professors, and authors of medical of studies in medical journals. These are two of my favorite sayings. Wrong does not cease to be wrong because the majority believe in it. So if you want to do something and do it your way, well, that's up to you. If you have knowledge, let others light their candles with it, Sir Winston Churchill. So let's get to the basics of molds, mold spores, and mycotoxins. Spores of toxic molds contain mycotoxins. The spores do, okay? Not the molds. And mycotoxins associated with spores are likely to be absorbed through breathing, and then they go to other parts of the body, producing effects in all the rest of the organs. This is known now from the 1980s. So molds produce toxins known as mycotoxins. They're always present in homes or workplaces, car, the gym, that are water damaged, and they are always producing mycotoxins. Mycotoxin exposure is far more common than expected. In the United States, 85% of buildings have had past water damage, and 43% have current water damage. This is from a study done by Dr. Jack Thrasher, who was part of my medical center in Houston. If you look at the 3 columns of on the right side of the chart, aflatoxins, ochratoxins, and trichothecenes, you'll notice that the first one, aflatoxin, there is 0. There's some ochratoxin, but the majority is trichothecenes, meaning aflatoxins don't grow indoors. They grow outdoors. They're molds on plants and trees and shrubs and other things. 2 important points about mycotoxins. A mold that produces mycotoxins doesn't produce one mycotoxin. It produces a series of mycotoxins. So one mold makes many mycotoxins. If a mold known to produce mycotoxins is present in a home or building, then the mycotoxins it produces are present as well. Let's look at size, because this matters. Human hair is 100 microns thick. Spore is about 2 to 4. Mycotoxins are 0.1 microns. The spores being that small, 2 to 4 microns, means they get in the deepest part of your lungs and transfer directly into the blood. Mycotoxins being 0.1 microns means they're the same size of a COVID virus. So, folks, for those of you who think air filters work or whatever, if they worked, they would have used them during the pandemic all over the planet. And exposure to mycotoxins is mainly by inhalation. In other words, you breathe them in, or they get absorbed through your skin, not through the gut or food. Let's look at some clinical information. This is autism. This is some study that was published from Tufts University School of Medicine in Boston. 172 children with autism and 61 controls, meaning children who did not have autism. The authors showed significant difference in comparing antibodies to mycotoxins, not urine, serum blood antibodies between the two groups, with the autism group showing elevated serum antibodies to mycotoxins. And so Tufts University School of Medicine studies have found evidence implicating mycotoxins as causing autism. These two little boys on the left are twins. They came to see me. Well, mom and dad brought them to me when they were 5. They were kicked out of the special school they were in because they were too disruptive. I started treating them. This is them at age 6 on the left. On the right is the picture of them when they were just entering freshman year to study industrial engineering at the university. So you see how you can actually cure autism. And you can see in the left picture how happy they are. They're smiling. They're fine. They're no longer autistic. This is a young boy who came to see me when he was 6. He's now 11 years old, and he came to see me because he said, I'm on the swim team and I won the championship for the swim team of my school. He's back to normal as well. What are frequent misdiagnoses of mycotoxins? People think it's fibromyalgia and chronic fatigue syndrome, chronic Lyme, depression and anxiety, autism, as we just talked about, PANS, autoimmune diseases like multiple sclerosis and many others, dysautonomia, POTS, and of course, there's always breast implant disease. So let me show you this recent study from Johns Hopkins University School of Medicine. It's called Mistaken Identity. Many diagnoses are frequently misattributed to Lyme disease. So of 1,261 patients, 84%, 1,061, had no Lyme disease, although the doctors who referred them thought that was Lyme disease. Well, look at this. What did they find? Fibromyalgia, chronic fatigue syndrome, etc. So what do you see here? Fibromyalgia, chronic fatigue syndrome. This is what they thought they had. So that's mistaken identity. It's actually mycotoxins. And by the way, Lyme disease infections typically cause skin, musculoskeletal, neurological, and cardiac illness. Multiple complications and adverse outcomes due to unnecessary antibiotics. Antibiotics prescribed longer than recommended, or unconventional treatments for Lyme disease have been reported. This is from that study from Johns Hopkins. Here's another 2 studies. The first one is a 14-year study looking backwards, looking at all the studies that were published, revealed that 65% of patients referred for Lyme disease had other diagnoses that could explain. And what was that? Mycotoxins. And here's another one, Dr. Steer, etc. 788 patients. 77% had other disorders, not Lyme. Here are tests that are unsuitable Diagnostic test for Lyme disease, and you can see the study up at the top. Second marker here is polymerase chain reaction. And the fourth one, enzyme-linked immunoblood assay. You know what those are? Those are the studies by Vibrant and by IGeneX. They're unsuitable. So is the visual contrast sensitivity, and look at the CD57 positive. Those are all not suitable. Let's take a look at what just came out in global guidelines. Okay, and this is what has come out from the CDC. And I want to tell you that this has come out, CDC, I'm sorry, the World Health Organization, not the CDC, published 3 studies that are about an inch thick each on April 3rd, 2020. I'm sorry, not 2025. So just about, a little over a month ago. One is what is going to happen with mold problems or fungal. They're saying it's the next big pandemic that's coming. And then they discussed in another one the analysis of commercially available diagnostics. And lastly, what are the treatments available? And they're saying we got to get ready here. They also talked about Candida. Now, this is the World Health Organization, and now this is an article published in February of this year in the Lancet, because there's a lot from Dr. Google and Dr. Facebook and all these other places where it's just opinions and stories. Candida species are the predominant cause of fungal infections in where patients treated in hospital. So it really affects patients who are immunocompromised or chronically ill. In contrast, there's other forms of Candida, such as oral thrush, vulvovaginal Candida, can occur in otherwise healthy individuals. So all this big talk about Candida, folks, here's the latest study from February of this year. Having said that, let's move on to how do you monitor mycotoxins in plasma with patients with Alzheimer's and Parkinson's disease. What can you do for those patients? They looked at the plasma of 14 mycotoxins from MyMycoLab and diagnosed with a neurodegenerative disease, 44 Parkinson's disease, and 24 Alzheimer's disease. What were their findings? That they had ochratoxinase, sterigmatocystin, and deoxynivalenol as causing Alzheimer's and Parkinson's disease. This lady asked me not to black out her eyes. She wanted to show you how desperate she was with Alzheimer's here in October 2024, a few months ago. You can see how she looks and how her eyes express how she's feeling. Look at her now in April. Look at her smiling, and her eyes are alive again. That's a patient with Alzheimer's due to mycotoxins treated the correct way, not binders, not mast cell stabilizers, not whatever. Let me show you. This is another study on glutathione that was published, and it was a review study where they looked at a bunch of studies, reviewed them, and then they said, that this review provides evidence that glutathione is associated with the pathophysiology of Parkinson's disease. In other words, glutathione can cause it. So for all of those of you who are cycling through the binders and glutathione and binders and glutathione, etc., take note of this. Parkinson's disease and being caused by glutathione in this study. Let's look at this important factor among young women. Mycotoxins cross the placenta into the fetus. In particular, deoxynivalenol and ochratoxin, they cause miscarriage, stillbirth, prematurity, small for gestational age, stunted for gestational age, and mycotoxins were found in 73%, 3/4 of the amniotic fluid samples from fetuses with genetic defects. What about miscarriages and stillbirths? 35% higher probability of stillbirth, a higher number of premature births, and late miscarriages. That's due to mycotoxins. And they may also be complicit in the manifestation of conditions such as polycystic ovary syndrome, premature ovarian function, and endometriosis, which can cause serious problems in conception and in the maintaining a good, solid pregnancy. What does it do in men? It alters testosterone, reducing the efficiency of spermatogenesis, meaning the formation of sperm, reduce sperm motility, etc. And zearalenone binds the receptors on the male reproductive system. Zearalenone is one of the 14 mycotoxins tested for by MyMycoLab. Now look at this young woman. She wrote this herself. She wrote how she was constantly she had SIBO and been to many doctors. And this was in June 2021. And in 3 months of treatment for mycotoxins, look at her abdomen. And she wrote, first morning I've woken up with just about completely flat stomach with no bloating. I'm still dealing with some as the days goes by, but nothing compared to what I used to be. What else, folks? Let's look at the diagnostic testing. What test do you want to do? You want some test that has accuracy, precision, and specificity. Those are the ones that count. Well, let's look at that. Here's a study that was published in this year, April, 1 month ago. This says that the urinary excretion of two toxins, T2 toxin over time in humans, about 20% can be traced back in the urine. That means 80% is inaccurate. The urine testing is 80% inaccurate. What does this other study published in October 2022, 3 years ago, well, 2.5 years ago? It showed that the serum testing, ELISA method for human serum comes with significant accuracy, precision, and specificity. And that, as a doctor, is what I want for my patients. I want the test to be accurate, precise, and specific, not 80% bad. So this one says, if you really want to believe in urine sampling, you got to do it several times during the day. And because of various factors such as gender, whether you're male or female, how old you are, your diet and muscle mass, all those can influence creatinine secretion, which is what the urine test is based on. And by the way, if you ever sleep Ochratoxin in urine, well, let me tell you, that's why the urine testing is not what it is. 99%, 99.8% of ochratoxin is albumin bound, the number one plasma protein in the circulatory system of humans. Its elimination by glomerular filtration is negligible. Studies verify that the toxin is able to be reabsorbed from practically any part of the nephron and the kidney by both active transport and passive diffusion. That's why that test is no good. This is an AI overview from Google, if you want to believe in Dr. Google. Urine tests for mycotoxins measure levels of mold metabolites excreted in urine. That's right, folks. You're not measuring the actual mycotoxin. You're measuring the metabolites. What is a metabolite? So if you tomorrow at lunch have asparagus included in your lunch, the rest of the afternoon, your urine is going to smell like asparagus because that's the metabolite of asparagus. See how not specific it is? It's totally off. And it's important to note that the CDC and FDA do not endorse these urine tests for clinical diagnosis. Blood serum antibody testing is considered more accurate for detecting mycotoxin exposure, as published studies have shown urine testing to be invalid. And what else, folks? Here is the CDC use of unvalidated urine mycotoxin tests. Okay. So this is the most accurate test. It is MyMycoLab.com. It's available internationally. It gives you 14 different mycotoxins, IgG and IgE, for a total of 28 test results. The IgG is a toxic reaction. The IgE indicates if you're currently being exposed or not, and it can activate mast cells. Once you have the test results, you can have a complimentary consultation with me to go over them. Let's debunk useless tests. This is from Dr. Vojdani, a brilliant scientist having published well over 200 publications, saying that this study by Udall and Mailing, several popular organic acid tests, the OAT test, claim to detect imbalances in gut bacteria and fungi. But most of the microbial markers of these tests do not measure what they claim to. What other useless tests are there out there? Here's the list. Look at that. Let's look at these. VEGF is a major player for leukemia and lymphoma, has nothing to do with molds or mycotoxins. The visual contrast test, there's no studies linking this to molds or mycotoxins. And Marcons is a total imagination of shoemaker Nathan Crowd. It has not one single study showing this even exists in medical science. What about the HLA-DR? They say that it affects 25% of the population, meaning 330 million Americans, 25% have this. What does that mean? 82.5 million Americans. Well, there's no published studies relating HLA-DR to anything with molds and mycotoxins. No research. It's not taught anywhere. But let me show you something else. In this particular situation, there are 32 million Americans who have diabetes. That's 50 million less than this. So what is it? Pure myth and bunk. What about the sensitive patient? They can't tolerate anything. These are the people who've been on 20, 30, 40, 50 supplements. and that develops into mast cell activation. Remember, folks, in the yellow, wrong diagnosis and wrong treatment, the patient continues sick and gets more sensitive. You have the right diagnosis, the right treatment, the patients get well in 6 months. That's it. 6 months is the treatment. What about these supplements? Here's what a recent study found. 11% of nearly 60 tested dietary supplements actually contain an accurate amount of the key ingredients listed on the label. 11%. 40% had nothing that was on the label. What else can we find in these supplements? Well, here we go. An analysis of 40 dietary supplements for the presence of lead, arsenic, mercury, cadmium, or pesticide. They found elements of one or more of these in 93%. How important is it for you to take the right one and not taking things that have lead, arsenic, mercury, cadmium, or pesticide? That is essential. I don't want any of these things to be given to my patients. And then one study reported for botanical supplements, we're talking about like oregano and things like that, contains plant species not listed on the label. Additionally, active ingredients substitution was observed among 83% of the companies tested. So you see what I mean? When you're taking all these supplements, and I don't know, from all these places, whoever is giving them to you, what do you need to do? You need to take 8 specific nutraceutical supplements and vitamins at specific doses. You get those from Detox Pure. Now, let me tell you, folks, what I did with these people at Detox Pure without them knowing it. I sent it to a third-party lab to test them for all these heavy metals like mercury and cadmium and arsenic, etc., and to test them for pesticides, and to test them also for any insect parts. And what was the result? 100% negative. They were clean, 100% clean. That's the place to get them from, detoxpure.com. And here's a doctor. I gave a lecture. I gave this lecture at the big A4M conference attended by 7,000 people in Las Vegas, Nevada in December 2024. And this lecture, this doctor came out and sent me this email. Dr. Campbell, I am simply blown away with your knowledge base. After hearing you at A4M, I dove into your videos, and I wish I had met you years ago after getting sucked into the Shoemaker and Nathan vortex. At least going forward with your direction, I will be able to help, to truly help my complicated patients. Next time, write it down, folks. 2 weeks from now. These are a few of the 100+ studies that I've published. You can always email me, at immunedoctor@gmail.com. So now let me look at some of the questions we're getting. Hello, Misty. When is it helpful to use both EDTA and nasal spray and amphotericin B? Well, the medical evidence says only use amphotericin B. It does not say anything about EDTA. And that was a published study by Dr. Ponikow, chairman of the Department of ENT Surgery at the Mayo Clinic. After 6 months of treatment with itraconazole and supportive supplements. I'm not sure what supportive supplements mean. Most of IgE decreased, but most of IgE increased. What could it mean? It means that the treatment wasn't either correct or that there were other things not included, which are essentially one is the diet, which has to be an anti-inflammatory, low histamine nutritional diet, and there has to be the right supplements from at the right doses. And that's a common question. My pharmacist says that taking magnesium glycinate with itraconazole is not safe. Well, I've published over 100 studies. How many studies has your pharmacist published? He said it can either increase or decrease. Is that correct? No. Ask him to show you the evidence. When I went to medical school, I was taught, in God we trust. Everyone else has to show data. Ask him to show you medical evidence. Are your reputable mycotoxin tests for the home environment to see if they are present? Immunolytics. I have been taking itraconazole and amphotericin B and your recommended supplements. Breathing was better. Brain fog lifted after the first few weeks. Now feeling exhausted and achy again the past 3 weeks. Somewhere you were re-exposed. Maybe at a store that you go to regularly. Maybe at the gym if you go to a gym. It may not be your home, but look at your car maybe. And let me explain to you a car. It's going to get hot in the summer. A lot of people roll down their windows a couple of inches when they park their car to go into a building. And then there might be a brief thunder shower and you come out and the seat is wet. Who checks the carpet for any mold growing in the car carpeting? See what I mean? I've had a lot of people say, I tested my the carpeting in my car and it was positive for molds. If tests positive and you remove yourself from the moldy environment without taking any detox substance, will your IgE go down? No, ma'am. You have to treat it. Just by itself, you could move to the other side of the world. It's not going to go away. It's like, okay, say you were exposed to mercury. Just because you're no longer exposed to mercury doesn't mean that mercury in your body is suddenly going to go disappear. Have you read, I know William Davis. Yes, I've read it. Thanks for all you do. I appreciate your work. I listen to your videos over and over again, and I've learned a lot. You've shown in several videos the lesions that people had on their legs, face, and arms. I understand these are symptoms of mast cell activation syndrome. Not all. Some of them are due to autoimmune diseases. I've developed these symptoms the last 2 to 3 months. These present as red blotches on my lower limb. My question is, what is this and what causes this condition? Perhaps the immune system is having a cytokine situation and this skin condition erupts in these lesions. I've been on itraconazole for over a month. They're beginning to recede, but it's slow. Yes, the first 2 months you're in the negative. Make sure you're no longer exposed is the first rule. Second, after you're no longer exposed is when the treatment begins. Treatment is itraconazole, the 8 specific supplements and vitamin at specific doses. And number 3, it's the nutritional anti-inflammatory low histamine diet. Yeah, I know Bill Davis writes about SIBO. He writes all about the gut. That's what he does. I have his books. Will taking itraconazole get rid of the vestibular migraine and the associated neurological symptoms? The first place mycotoxins go is to the neurological areas of the body. So yes. Is it normal to get sinus pressure and congestion during the follicular phase of the menstrual cycle, days 1 to 14 to 17, and for it to resolve and feel better, and the luteal phase from day 17 to menstruation again? Or are these symptoms abnormal and a sign of unhealthy estrogen like zearalenone? That's typical of zearalenone effect. Does anyone have a clear MyMycoLab test resulted great? I see that every 2 weeks, that they're back either in patients who've been treated or somebody who's not sure and they send in their blood and it's and it's in that all the way on the left column. There's many of those. Is there a reputable mycotoxin test for the home environment to see if they're present? That's the immunolytics test, one word. For mycotoxins specifically, look into respiratory. Wait a minute. Respiratory. They have a new IOM device that tests for mycotoxins. Just a suggestion. Immunolytics. Here we go. That's the one that I would recommend. Does itraconazole treat lungs and brain? Yes, it does. I'm taking it. Haven't noticed much improvement. How crucial is taking a nasal spray? Only if you have chronic sinus problems is the nasal spray with only amphotericin B at a 0.3% solution used. It takes 2 months to start feeling improvement. It doesn't happen within a couple of weeks or a month. I am now healed from mold toxicity and looking to heal my 4-year-old who shows sign of autism. What would be the duration and dose for him at 42 pounds? Well, 42 pounds is 20 kilos. So it would be about a fourth of the adult dose. What do you think about specialized treatment approaches for different mycotoxins? These are mycotoxins are molecules. Do you have a different approach for molecules? That's really doesn't make sense. Been on your program for 4 months, feeling much better. However, I have a significant weight gain and eating low histamine diet. Any suggestions? I don't know what your medical history is like, etc. So it's hard for me to determine that. If you're on a low histamine diet, you should also be on a low inflammatory diet. No gluten, no dairy, no soy, no artificial anything. Is a diabetic treated any different on your plan? Do they need to be monitoring of anything other than liver enzymes? No, it's the same. You can monitor for the same things as anyone else. Your team sent my family 2 doctors that could prescribe itraconazole, and neither of the websites given to us went to anyone that could. Not sure what went wrong. Is there a way to get a list? Yes, I can tell you right now. Mold Mend, one word. Mold, MOLDMEND. Moldmend.com, one word. I trained them. Hi, Dr. Campbell. I was surprised that my IgG went lower end and +1, +2 since my symptoms and illness are so severe. My IgE was the +1. Do the results correlate with severity? Well, let me ask you something. Have you ever known a couple? They're both exposed to the flu, and one is sick for a week and the other one is well in a couple of days. That's not the point. Everyone's immune system is unique and different. So some people get very much affected and some not so much. I've treated families, mom, dad, and 5 kids, all under the age of 15, and every one of them had a different result of their testing. It has nothing to do with the symptoms. It has to do that everyone's immune system is unique and different. What does it mean? My IgG is very high, but my IgE is very low. Okay, well, IgG is indicating that you now currently have a toxic reaction going on in the body. If the IgE is almost in the blue on the left-hand column, means you're no longer exposed. How long is the treatment? It's 6 months. Everything is 6 months. And that's why you don't repeat the test until 6 months are over. Mold exposure cause histamine issue, or does it simply make it worse? It depends on how elevated are your IgE, as in Edward, antibodies. How do I get rid of belly fat for my sleep issues, from mold and TBI? Well, I'd have to know a lot of more information from you. Jill Christa's approach, read different, specialized for that. Well, that's, show me, okay? In God we trust. Everyone else has to show me the data. Can you show me the studies that show that each one has to be treated or whatever in a different way? How do you know when to stop IVIG? Asking for a friend from the Pandas Facebook group. It depends on the medical history examination of every individual child who has pandas. I wrote a book in the year 25 years ago, in 2000, on IVIG use. So I know a lot about it and how to give it and how long you give it and when to wait for results. Will treating with Spornox treat the constant mucus in my nose? If not, what else can I use for nasal spray? Amphotericin B, 0.03% solution, as published in a study on 210 patients with chronic sinusitis by Dr. Ponikow, chairman of the Department of Ear, Nose, and Throat Surgery at the Mayo Clinic. That's medical evidence, folks. That's not a Jill Christa or whatever. When having been exposed to the zearalenone and having some imbalanced hormones, are their hormones kind of wacky for a while and take a few months to regulate themselves again when treatment and not being exposed again? That's correct. I really feel good compared to the past times during the first few weeks of treatment for the first menstrual cycle, but the second menstrual cycle, I don't feel so great. And I've been having trouble with sinus eustachian tube dysfunction. Okay, that's when you need the amphotericin B nasal spray. I don't feel great, but I feel like my hormones are at least changing. Is this normal? Yeah, it takes them 6 months to completely heal up. Our entire family was elevated for all 14 mycotoxins. 4 of us are always in the same environment. However, our lungs, our IgEs are very different. Why would this be? Because every one of you has a different immune system, and every one of you is going to react differently from any kind of immune exposure. Had mycotoxin test, not sure what to take or not to take. It's illegal to draw blood for mycotoxin test here on PEI. I'm not sure what PEI means. Is there any way to prevent cross-contamination of molds, mycotoxins from another person's home into your home if their home has a positive mold test? Well, first of all, I wouldn't go over there. And you know, when you're cross-contaminating, that's the last thing you want to do. You don't want to bring into your home what's in that home. Can ALS be cured with this protocol? Please watch my recent video on neurodegenerative diseases that include ALS. It may not be cured, but it can be stopped. Anything different in mold treatment of the person who is also chronic Lyme, please go to YouTube and watch my Lyme presentation. You will be surprised. You mentioned that mycotoxins get to the neurological areas first. Is that also the first place they leave during treatment? No. Or is there an order how the mycotoxins leave? There is no order. My IgE is in the +1 and my current apartment has active mold. What does this mean? It means that you have active mold in you because it's positive. It doesn't have to be ultra positive as long as it's positive. Think of mercury. How much mercury is okay to have? Is it okay to have just a little bit of mercury? Or do you have to have a lot of mercury? No, any mercury is bad for you. Can a patient with CVID on sub-Q version of IgIg take itraconazole? Yes. My test is still pending with you. It's only been 6 days. I can't wait to get an appointment with you. My liver levels are up on itraconazole, but I've been getting lymphatic massage, which may be releasing a lot of the toxins. Yes, it can, but which may be recirculating. Should I stop the itraconazole, keep doing the remaining 3 months? I think that's something you need to ask your doctor and maybe stop that lymphatic massage. Are there any pharmaceutical medications that are contraindicated with itraconazole? Usually anticoagulants, antidepressants, and anti-anxiolytics. Pretty sure all my autoimmune issues are due to mycotoxin exposure in my old house. Is there any point in treating when it is doubtful I will ever get eradicated? Watch the videos. You can see patients with actual pictures of autoimmune diseases on their skin, like psoriasis and rheumatoid arthritis, etc., and after 6 months of treatment. So yes, you can. If you retest after 6 months and you need to continue longer, how long is it safe to continue? It's individual. Everyone's immune system is unique and different. Are there side effects to amphotericin B nasal spray? Yes. You start clearing up your sinuses and you feel better. When I move, do I have to get rid of all my stuff? A lot of it, yes. Will we feel worse on itraconazole before we feel better? No. I think we can all agree the majority of people's home have mold and mycotoxins for many reasons. I'm sorry, but I had this home tested last month and has none. And I'm here in Florida, in Tampa Bay area, which has been hit in last year by 2 hurricanes, and I don't have any mold. I'm wondering what this means for us while we are undergoing treatment. Should we be isolating, quarantining our mold remediated area, or now clean our homes? No, you need to remediate, and once you've remediated, that's it. You're fine, and you start your treatment, and it goes well with you. Any other questions? Why do these mycotoxins in outdoors not hurt us like indoors? Let me ask you something. How many square feet is your home? And how many square feet is it outdoors? Now you understand. Any other questions, folks? All right. Well, I hope you've enjoyed this. Well, here's a couple more questions. Well, how do you know if your sinus issues are from pollen or from molds? Do the MyMycoLab test. It's as simple as that. You do the MyMycoLab test, you will know what is going on. Will treating get me off high blood pressure that I believe is from mold? It depends. I don't know your medical situation completely, so it's hard for me to give you an opinion. Can I set back our treatment if we're going to go spend time in a home or building that has mold? Why would you go to a place that's contaminated? Let's pretend it's not mold, it's mercury. You want to go into a mercury environment for a while and see what happens to your body? Thank you for your time and knowledge. Thank you, Miss Cindy. Appreciate that. Who can we consult about our building and homes? Okay, it's Brantley May. That's right. Thank you so much, Misty. And the website is envirohealth.co. You make me laugh. Thank you for helping us. Thank you. You're very welcome. Laughter is the best medicine, folks. Does mold often cause high blood pressure? It can. By the way, I'm glad I made you laugh. Let me ask you something. Do you know what used to happen before crowbars came along? You don't? Crows used to drink at home. Do you see MCAS resolving after itraconazole treatment? Please watch my videos where I actually show patients before and after. They're all on YouTube. I may have missed this since I signed on. Can you speak to EMF and mycotoxins? Yes, I've presented it in many previous videos. If you would please go to my videos on YouTube, you can watch the ones. And yes, EMF is an issue with molds and mycotoxins. Well, I've been taking itraconazole for 9 weeks, but continue to have extreme MCAS. MCAS doesn't come from pollen. Can you please explain how it causes high blood pressure? It affects the endothelial wall of arteries. And those are studies that have been published. Is there anything additional that will help support gliotoxin detox in addition to ITRA? I would recommend that you follow the 4 points. One is get away from the toxin. Second is to take itraconazole. Third is the 8 specific supplements and vitamins. And 4 is the low histamine anti-inflammatory diet. How do people like me that are too poor to attend a proper mold literate doctor, mainly for losing everything to mold, receive itraconazole from a private? Well, I would go to moldmend.com, MOLDMEND, and talk to those folks. And if that doesn't work, send me an email. Are fatigue, salt cravings, hypoglycemia, and excessive thirst? Yes. Yes, and adrenal problems from mycotoxins are common. Does mold toxicity always coincide with MCAS, or does it depend on the length of exposure? No, it doesn't. No, it does not depend on the length of exposure. Could COVID or the COVID shot have made me more susceptible? No. Can you speak to auditory neuropathy? Is this connected to a permanent result of mycotoxins? Another doctor and I published a study in 1994, 21 years ago, on how molds and toxic molds and mycotoxins cause a neurological auditory problem, causing the auditory nerve to not to function properly. So depending on your particular situation, it can be fixed. What do you think of cholestyramine binders? I think show me okay, here we go back. In God we trust. Everyone else has to show me evidence. Everyone else has to show data. There is no data showing that binders work. Please watch my many web videos on YouTube. I show you the actual cause. There's 3 studies, and those 3 studies show that binders don't work. Is it normal for allergy season to cause sinus pressure and ear fullness? Or is that people that are mycotoxin exposed that react to pollen? No, mycotoxins is apples, and pollen is cucumbers. They're separate, completely different. When will I start to feel better on nitroconazole? After a couple of months. Can decades of mold exposure indirectly or directly cause intracranial hypertension? Yes, it can. Folks, we're getting to the end of this now. I can take a couple more questions. And if not, I hope you have a great rest of the evening. And I'll see you in 2 weeks, folks. In 2 weeks. And thank you for kind words. Everyone. And if the whole family was exposed, but some don't show symptoms, should we still test everyone? I would test them. I don't test people who are fine. Nobody comes to me and says, I feel great, please test me. So I would only test people who don't feel well. Thank you so much, everyone. You're very kind. All righty. By the way, the study is called acoustic neuromas. Wow, look at that mold. Woo. All righty, folks. I appreciate you coming and listening. I'll see you in 2 weeks. I'll have some more information for you then. God bless you all.